Well, we've got the grass growing, the flowers and trees are blooming, and it's likely that your spring allergies are acting up.
But the question tonight is it really allergies? Because keep in mind, there really is an overlap between the allergy symptoms, the coronavirus symptoms, and other illnesses. So tonight, we asked the doctor for the key distinctions.
Dr. Samuels, we are now in the spring allergy season. How do we distinguish the symptoms from allergies versus everything else that you're seeing coming in your office in the middle of this coronavirus pandemic?
Well, there certainly is a large amount of overlap between flu, between COVID-19, between the allergy season as well, too. Allergies, the biggest thing you're going to see is no fever. You're going to see a lot of symptoms like watery eyes, itchy eyes, runny nose, maybe a little bit of a sinus headache with it. But the drainage will be clear usually, too. It will not be a purulent drainage from the sinuses.
And then, so tell us, what about the symptoms that we should be hallmark of the COVID-19, top of our brain?
COVID-19, again, can have the runny nose, okay, but you're also going to have a really dry cough, pretty bad sore throat, and you're going to have a fever almost all the time. We are seeing a little bit of conjunctivitis, irritation of the eye. We see some muscle aches. The main thing is that fever on top of it is what you're really worried about, and a dry cough with some shortness of breath.
And flu season, I think of it being in the winter. Is it over? Are you still seeing cases?
We're still getting positive cases of influenza A and influenza B, and it's important to catch that quickly. If we can catch flu in the first 48 hours, we have Tamiflu to treat it with. So again, very similar symptoms to COVID-19, it's a very treatable disease if we catch it early.
And what about bronchitis and sinusitis? These are also issues, these are illnesses that have some of the that seem similar. What are the hallmark characteristics?
Yeah, still seeing a lot of it of that too. We're seeing symptoms of bacterial infections like an asthmatic bronchitis or a bacterial sinusitis. The hallmark of that will be yellow or green drainage, either from the sinuses or from down deep in the lungs. And so those are the main differences there. Those are very treatable with antibiotics. So again, that's another reason to seek medical care if you're having that. But otherwise, kind of similar symptoms. If it's a bacterial sinusitis, you get the headache, you get a little bit of runny nose with it. If the asthmatic bronchitis has a lot of cough with it, but definitely a more purulent sputum than we see with COVID-19.
As we start a new work week today, are you seeing any difference in the demand supply types of patients that are coming into your office on the south side?
We're busy. People, have been trying to put things off, and so it's getting busier and busier as things go. We're doing a lot of telemedicine, especially with our older patient population, trying to keep them out of the office. More and more patients are wanting to come in just because they need things treated. They need their lab tests. They need an X-ray, so they have to come in and seek medical care. But no, it's getting busier. A lot of stress out there too. People are worried and concerned, and we're doing a lot of that as well too.
Right. All right. Anything before we wrap up today, Dr. Samuels? A word to the community about how to cope and keep ourselves healthy during this pandemic?
Follow the guidelines. Stay home as much as possible. Try to separate, and not go out and use your social distancing. I do think using a face mask when you're out is polite to others. So if you're going to the store and you can fashion a face mask or have something like that, I think that's very, very important at this time.
All right. Thank you, Dr. Steve Samuels. All of this information about the different symptoms are posted for you online at WTHR.com.